good evening. Welcome to your weekly show, Ask Dr. Saw. This weekly health show is now becoming a part of your home, and we really welcome you and the support that you've been giving us. Ask Dr. Saw is a forum for you, the public, to call in and ask your questions about health matters and ailments and so on. No better person to answer those questions than Dr. Saw himself. Dr. Saw, welcome.
Thank you. Thank you again for having me.
Yeah. As you know, the show, as I said, we come to you every Tuesday at 8 o'clock. Tonight we had some technical difficulties, and we would like to apologize for the late start. These things happen from time to time. We don't prepare for them, but they happen. But like this, as everything else, we must continue. We've seen a number of questions from the last show regarding various topics, and Dr. Saw will be answering those questions this evening. But first, we would like to start by talking about our topic for tonight, and our topic for tonight is asthma. Well, before Dr. Saw goes to, I ask him about that. Let me say that please be responsible with your calls when you call into this show. Please do not mention the names of individuals or healthcare workers or healthcare facilities, because that can get us into some trouble, and you wouldn't want that either. So again, thank you for joining us tonight. We'll be taking your calls, and we're going to give you a few extra minutes this evening because we had a little bit of a late start. Dr. Saw, this evening we are going to be talking about asthma, and there is so much I want to talk to you about asthma, because I remember since as a kid growing up, you always hear people saying, as you reminded people, say they got blow-in, right? Yeah, which was another term that was being referred,
Yeah.
But exactly what is asthma?
So indeed, when people say they have blowing, that means you would think something to do with their breath. And it is usually, they say they have shortness of breath. We would describe that as shortness of breath. But I know I grew up in the country as well, and we refer that as blowing.
Yeah.
But what is asthma? I mean, we've seen patients, we've seen public campaign on asthma, we've seen, lots of people presenting with asthma. The definition of asthma is a chronic reversible airway disease characterized by bronchospasm and inflammation of the airway. Now, I will explain that and break it down just for you to understand. So when I say it's a chronic condition, it means it's not something that you get it today and it disappear forever. So you get it for a long time. So it's chronic. It is a reversible airway disease, meaning it comes and it disappears. It can come again. And yes, over time, some people can not have it, so they can grow out of asthma, as you see.
Yes.
And we see that in children, they grow out of asthma. And like other conditions that are related, things like eczema, they can grow out of that as well. So it's chronic, it's reversible, it's an airway disease. That is, it affects the airway. What do we describe as the airway? The airway is you breathe air into your lungs. So usually it affects the airway in the lung, the tubings of the lungs. And it is characterized by bronchospasm, so the airway has got a size, and it's made up of muscles. The walls are made up of muscles, and if the muscle tighten and constrict, we call a constriction of the muscles, you have, or spasm of the muscle, it narrow the airway. And if you notice, I mean, if you take let's say something, a pipe, let's say, not a pen, but like a straw.
Yeah.
And you make it smaller and you blow into it, you'll hear a whistle.
That's right, yeah.
We do that as kids. We make whistles.
Yeah.
So likewise, if the airway gets narrow and smaller, when the air moves in and out, it gives you that wheezing.
All right.
So that is what gives you that sound. So you have what we call inflammation. That is, you have secretion. So you get more phlegm production, and that blocks the airway. And as you know, you need to get air into the lung, and you have an impairment of exchange of air. However, in asthma versus other respiratory condition, the obstruction tend to happen where you can breathe in the air, but you can't breathe out the air.
Right.
So if you look at how asthma patients present, they go, they're trying to breathe out with an effort. When you're breathing, you breathe in slowly and you breathe out without realizing you're breathing out. The lung has got a recoil, like an elastic. You pull it, it goes back. So the lung has got a mechanism. But in asthma, that the air is trapped and you have to take an extra effort to breathe the air out. So that's the definition of asthma. And of course, as I say, the presentation would be shortness of breath. So you're having difficulty breathing. You will feel fatigue because you're using other muscles to help push the air out. You have low oxygen in your body. So of course you get fatigued and tired. You'll have a noise. So that noise is wheezing. So that heavy breathing and a whistling sound, that is wheezing. And eventually asthma can lead to death.
Yes.
If you have a complete occlusion or complete blockage, you have no oxygen, eventually you can die. So we should not trivialize asthma. Asthma is a very serious condition. It is accounted for lots of death yearly. It carries lots of what we call morbidity, that is illnesses where you have to take time off work, hospitalization. So it can be a serious condition. Thankfully, of course, the majority of patients we know, probably, they have mild to moderate asthma.
Doc, from time to time, I would see people with this little
Puffer.
Yes, they puff that, and that seems to be one of the treatment of asthma. But what other treatments are there for asthma?
All right, so there is a stepwise way of managing asthma. So when we talk about, so there are different types of asthma. We have what we call intrinsic and extrinsic asthma. Intrinsic asthma where there's no known cause. Extrinsic asthma can be related to things like hay fever, what we call atopic condition, where your body is hypersensitive, and there are some triggers. So the first thing I would find out from patients, are there any trigger that cause your asthma? Does your asthma come on in a certain environment? So there are triggers like allergens, we call them. So certain environment, people working in dust,
Right.
in environment where flour, bakery, certain metal industries, you can have that. So we refer those as occupational asthma, but there are allergens can trigger asthma. Now, so when we look at how do we manage it, we would first want to look at if there are triggers, we try to avoid those triggers. And subsequently, we look for medical management. So what are the management? I said to you that the airway is inflamed and there is spasm. So we want to give a drug to take away the spasm. So we give a muscle relaxant. We call it a bronchodilator. So we say constriction is when it tightens,
Right.
the airway tightened. We give a drug to reverse that, which called open it up.
Yes,
so that's called a bronchodilator. And that's the blue inhaler. So asthma has got a stepwise way of managing it. So we have 5 or 6 steps in the management. So I'll just quickly run through that. So step 1 is when you use that blue inhaler alone. So there are patients with mild asthma. They just have an occasional wheeze now and again in certain environment. If they're exposed to things like cats and dogs and dust, it can trigger an asthma. And they occasionally need, or if they exercise, you have something called exercise-induced asthma. And we just give them that inhaler. The blue inhaler opens the airway, job done, they're happy. So that is very mild asthma. If you have need to use the inhaler more than 3 times a week, it means your asthma is a little bit not just mild, a little bit more, then we will give you a drug to prevent this. And the drug of choice would be what we call a steroid, inhaled steroid. So you have steroid tablet like prednisolone that we know of. You take that as tablets. But what we give in asthma, we give an inhaler, a steroid inhaler. So that's the second inhaler. So we'll start you on the blue inhaler. What the blue inhaler does is just relaxes the airway. We then want to give you a steroid inhaler. What a steroid does, it's an anti-inflammatory. So I talked earlier about inflammation of the airway. So the steroid takes away that inflammation or prevents that inflammation. So you give a steroid inhaler. And of course, if the asthma is not getting better and you're still wheezing, we then give you a third inhaler, which is a long-acting drug of the blue inhaler. So the blue inhaler is a short-acting, we call it short-acting bronchodilator. The other one is a long-acting bronchodilator. Now, still, if the asthma is not controlled, there are other drugs. We give what we call like an allergic type of drug, leukotriene inhibitors, and because in the inflammatory response, there are lots of chemicals that are released. So there are drugs we can give for that. And then eventually patients who have what we call exacerbation of asthma where they have severe asthma, you would end up giving them steroids. And then in the last stages of asthma, there are newer drugs now called biologics, where we can give them injections and drugs to prevent asthma. So there is lots of medication for asthma.
Yes.
So it's important to assess where you are in that in the presentation. As it mild, moderate, severe. We start you appropriately with the different medications. So you may start with 4 or 5 medications initially. As your asthma get better, we reduce it until minimal medication. Sometimes you're good for 6 months of the year, and another 6 months your asthma flare up. So it's a case whereby we constantly assess and evaluate you.
You mentioned earlier that asthma, there is no, people can grow out of asthma, but I know for a fact that some kids has asthma at a very early age. What causes asthma at an early age, in perhaps at infancy level or a little older? Because I see kids sometimes
Yeah, no. So there are different theories where our immune system, there are certain triggers of the immune system. It could be viruses, it could be something that we've used in the environment, something we are exposed to the environment, and then you have a genetic predisposition. So with a genetic predisposition and the environmental triggers, it can cause the immune system to be hyperactive, and you present with asthma. Okay. So those are the kind of thing that happens. So asthma, there's no age for asthma really. It can happen in young children, older people. It's difficult, however, to diagnose. Majority of asthma, it's difficult to diagnose in early, childhood, age 2, 3. It's difficult because the tests to do for asthma, there are different tests you can do where you blow into something. It's called a spirometry, and they measure the volume of the lungs. Now, if it's difficult to get a child to do that. But having said that, we see that lots of children initially, when they have a viral infection, they have normal flu, cough, cold, runny nose, any virus, they can have a bit of wheezing. So we call it viral-induced wheeze. And those patients can go on to have asthma, or they have a predisposition for asthma as well. So in the younger age group, I tend to not label these children in the beginning to say, fine, you're classically asthmatic, because most of them present with those wheezing symptoms, especially with a viral infection, and those are triggers. But we have to wait and see how it evolves. Yes, if they were to get asthma without, that is the wheezing and shortness of breath, without an infection, then we can say more or less this presents more like an asthma. Because sometimes you can't tell the difference.
Last thing before we go to call, we got to start taking calls very soon. Last thing before I ask you, there are many herbal treatments and so on going around for asthma, because a lot of people say, well, if you mix these particular flowers or these particular things and drink it, these particular bush, what now I don't know how that clashes with you, but
I mean, it's difficult. I mean, I don't know a lot, as I said before my earlier episodes, that I don't know a lot about these herbal stuff. But we know that there are certain food and certain plant products that can work as a bronchodilator. Okay. So they can relax your airway. And they do, like coffee, for instance, can relax your airway, and it can work as a bronchodilator. But are we going to recommend that for asthma treatment? Probably not, because we don't know how much, for how long, things like that. So I know there are herbal stuff, but I'm not afraid with them all, and I can't make a recommendation.
Right, and you in your capacity, you would say that somebody should get medically checked.
Yeah, definitely. So asthma is we should not trivialize it, as I say. It can lead to death. So you need to, see your doctor, discuss those options, and if there was something you're using, and it is, we research that and we know that there are no side effects and it is working, then why not? I have no objections to that.
Okay, great. So we're gonna open the air, the phone lines now. Our numbers are on the screen: 231-2982, 610-1066, and 652-1314. You can get us on WhatsApp, and you can call the line directly. So the lines are open, but while we're waiting for some calls, I'm gonna go to some of the questions from last week. So Doc, let me ask you.
I mean, just that comment I saw, Doctor, is true deep breathing can help. So indeed, any breathing exercises. So when you have any airway disease, any lung disease, we do a rehabilitation, pulmonary rehabilitation, and it involves breathing exercises. So without a doubt, breathing exercises will definitely help. So all asthmatics, anybody with lung condition, we would recommend that. So I just saw that on the screen.
Okay, great. So somebody says here, I remember my aunt had blowing years ago, and Dr. Wills gave her a blue pill. When we came to New York, we got her the inhaler. All right, so we have a call here. Let me take this call.
In the old days, they used to give tablets more. Now we find that topical or inhaled treatment, less side effects.
Good evening, caller. You're live on air.
Hi, good evening, Akash. If you're hearing some noise in the background, it's my two granddaughters creating havoc in the room here.
Okay.
Doc, once again, I have to reiterate my sentiment, my passion, my commitment to you for being this wonderful doctor that is giving us this free medical medical advices and knowledge of your expertise. Again, if you're hearing some nice hits, my granddad.
Yeah, that's all right. Yeah.
All right.
And Akash.
Yeah, what do you want to talk about tonight?
Brother.
Yeah. Thank you.
Well, I just want to say that I mean, last week I said I give Doc a virtual hug. I want to do it every single time.
All right,
thank
good.
you. Thank you for that.
This human being is unmatched.
All right.
Where can we find human being like this guy who can come and express his medical advices free of charge?
Yeah. All right. Thanks for coming through. Have and enjoy your grandkids.
Thanks, guys.
Okay, good.
Okay,
Yeah.
thank you.
Bye. All right, so Doc, let me read you. Let me read one of the questions from somebody said here. Can you please give some info on rheumatoid arthritis?
Sure.
I am
on prednisolone and methotrexate, but I'm having some side effects with these drugs.
Yeah.
Okay, so rheumatoid arthritis is a type of inflammatory arthritis. So when we talk about arthritis, itis is inflammation, so arthritis is inflammation of the joint. So just break it down for patients to understand. And there are different types of arthritis, which rheumatoid is one of them, and it is described as an inflammatory arthritis. That means the joint is inflamed. When a joint is inflamed, something is inflamed, what happens? It is red, it is swollen, it is painful. Okay. So if somebody's present with rheumatoid arthritis, we would expect to see the joint is swollen, it's red, it's painful, and it's usually warm or hot. Now, rheumatoid is a particular type of arthritis that affects symmetrical joints. So you'd find that you'd have one side, both sides affected. So usually these joints in the fingers. And of course, it's an autoimmune condition. So you have a genetic predisposition and the body reacts to something. And you have a heightened inflammatory response of the body. So the body actually attacks the joint. Now, what tends to happen? You have what we call joint inflammation, that is called articular manifestation of the joint, and you have extra-articular manifestation where it can affect any other parts of the body. Usually it can affect the lung, it can affect your skin, it can affect, other parts of your body. However, it is mostly the characteristic of it is joint inflammation. And indeed, there are different ways to manage it. So what we tend to give is what we call, so the initial treatment, of course, would be, giving drug to take away pain and inflammation. But there are specific drugs called disease-modifying drug. So disease-modifying agent, methotrexate is one of them that person is alluding to.
Yeah.
And prednisolone. So prednisolone is a steroid. We don't use prednisolone for long periods because it's got lots of side effects, weight gain and diabetes and all of that. So we tend to look for drugs that don't have so many side effects. However, prednisolone is a very good drug for acute inflammation. So when you have a sudden flare of it, it is useful for that. And also it's a way of also knowing that this is, you can do a trial, see the response, and you know, yes, this is inflammatory arthritis. So lots of time patients come in with arthritis that you're not quite sure, is this an inflammatory or not an inflammatory arthritis? A trial of that can make you, can give you the answer. Methotrexate is a disease-modifying drug, we call that. However, it's got lots of side effects. Common side effects would be GI upset, so it can cause nausea, vomiting. You can also have allergic response to it. That is a drug that we tend to monitor. It can affect your kidney, your liver, your lungs, so it requires lots of monitoring. If this patient is saying that they are having side effects with prednisolone and methotrexate, then I think the next option would be go on to what we call, you can do other disease-modifying drug, but those drugs are divided into your biologics. So there's another newer type of drug called biologics. And I think they should have a discussion with a doctor about going on to biologics if they can't tolerate the initial treatment.
I'm reading here, somebody just sent in a message, and one on WhatsApp and one on Facebook dealing with the same thing. Doc, what is acute asthma attack? What does acute asthma attack means and how serious it can be?
So I said to you, asthma is a remitting, relapsing condition. So it's an episodic condition. You get it, it can go away on its own or with treatment. So when you have an acute attack, you have acute presentation. It comes on just like that. So let's say if you're in an environment that there's a trigger and your asthma is triggered, that is called an acute. So when we look at, we have acute, meaning it comes on right away, and you have chronic, it is long-lasting. So if you have an acute symptom, it means it's a symptom that you get just a short period of time, and then you have chronic symptoms, which goes on for a longer period of time. So if you have an acute asthma attack, it means you're getting asthma right now. It's an acute presentation. Now, you can have mild, moderate, severe attack. So I suppose what this person is describing is an acute severe asthma attack, where you're having shortness of breath and you start to wheeze. Now that is that's an emergency. We treat that right away. So if it is mild, you'll start with the blue inhaler, you'll give your bronch inhalers, and if it gets really bad, then you will need steroid, that is oral prednisolone. And we look at triggers. So lots of time, if you have an infection, a chest infection, you can have an acute attack of asthma. So that is your acute attack. And then you have chronic asthma, where every day you wheeze or every night you wheeze. You cough sometimes, cough variant asthma, and you get shortness of breath. So in those chronic conditions, we tend to give drugs to suppress it kind of thing.
So the person is saying, is the same person that asked about the cure for asthma says, I seem to be allergic to many drugs, even Piriton, the allergy tablet.
I mean, there's no cure for asthma. As I say, it's a hypersensitivity of the body system, and sometimes your body just rectify itself. So I wouldn't say there is a cure, but it can be adequately treated. It's very unlikely that you can be allergic to lots of drugs, but most of the asthma medication are used in allergy as well. So it is, most of the times you can treat it adequately with medication.
Okay. So last week question again, let me go back to that. So this person says, good night, doc. I am a diabetic. It's getting worse. I'm using meds and insulin.
But my sugar is not controlled.
Control.
Okay, in my diabetic episode, we talked about when do you say sugar is controlled. When your HbA1c is around 7, 6.5 to 7, we say you're well controlled. We look at your fasting sugar and your average sugar over 3 months. Now, if you're on medication, I talked about how do we titrate medication. We start with one drug, we go to the maximum dose. We add a second drug, we go to the maximum dose. We add a third drug, like that. So we don't really stop drugs. We keep adding. And then when we have exhausted tablet options, we go on to injection, that is insulin. I would say to this patient, if a patient is already insulin, that is your last resort. Insulin is your last resort.
Wow.
But my take on that would be that the insulin need to be titrated. So what it means that, okay, you take insulin, you have the insulin allow the body to utilize the sugar that is there, but insulin has got duration of action. So some insulin takes a long time to start acting, and some insulin would act for a short period, some insulin would act for a long period. Now, depending on how much you eat and how often you eat, you may have to adjust the type of insulin you're taking. And there are different preparation of insulin. You have the short-acting, you have the mixed insulin, and you have the long-acting. So if I'm taking short-acting and the insulin stops working after 4 hours, and my sugar goes up after that, or I'm taking long-acting, but my sugar is spiking as soon as I eat, I would say to this patient, they need to review their type of insulin and the dosage. So we tend to look at what you're eating, how much you're eating, what's your sugar level. So I'll normally tell my patients, what is your sugar level fasting? What is your sugar level postprandial? That is after you've eaten. And then I will tend to decide on the type of insulin, what dosage, and sometimes I do a mixed insulin, and So it can be managed, but they need to be. A doctor needs to go through that.
Last week we were dealing with hypertension. Somebody had mentioned that they drink. I don't know if you saw the comment. Somebody said they drink water. They soak the melange in water and they drink this water, and it does wonders for them. So there are lots of these cures that you will hear.
I've never heard of that. But if you soak melange with water and you're drinking it and it's not doing, I don't think it will do you any harm if you soak it in water.
Got some antioxidants in
if
there.
it is helping you, then why not? But I have never heard of that. But if that is helping, then fair enough. Let's,
This is a general question. A lot of people ask this question, because it needs to be answered. Doc, does sugar, like literal, sugar that you cook with, does it cause diabetes?
The answer to that is no. Simple. So sugar, we all take sugar. So if that were the case, all of us should probably get diabetes. I said to you in our early episode, diabetes is multifactorial cause. So you can eat sugar and you would not get diabetes. I can eat sugar and I can get diabetes because I have a predisposition. So the answer is no, it doesn't cause it. But if you have too much sugar, you can put strain on your pancreas. Let's say there's something called pancreatic burnout, for instance. So we would say sugar can contribute to diabetes, or it can bring on diabetes onto you, but it is not the sole cause of it. It's difficult to give you, but I think the answer would be no. However, it can contribute for you to present with diabetes, but you would have already gotten that genetic predisposition.
Yeah. Somebody asked in the question here, Doc, if you have started to operate in Guyana. I know that, you try to keep that away, but somebody's asking, have you started?
Yes, I have started at Woodlands. I do 3 days a week, Monday, Wednesday, and Friday in the morning.
Okay.
At the moment. So, yeah, I'm there for now.
Another question here I see here is, okay, somebody said if you put okra in water overnight and drink it, it helps also. So somebody said, Doc, what's the normal range for diabetes, the number?
Right. So as I explained that earlier, that the diabetes, I'll give you some values. They are UK and the US values. So the Americans in the UK, normal, so there are two types of sugar. There is what is the fasting sugar. Well, different types, but in terms of when do you test it? You get what is called HbA1c, is the average sugar over 3 months, and then you have your fasting sugar. So a normal fasting sugar should be under 6. Between 6 and 7, that is millimoles. So if I were to calculate that in US terms, so 6 multiplied by 18.
Right.
So 6 times 18 is 108. But Americans use from 100, right? So 6 times 18, 108. So your normal sugar should be under 100 or 108 in England. So we'd use, in the UK, we use a value of 6 times 18, that's 108. If your sugar is over 7, so let's calculate 7 times 18 is 126. So if your fasting sugar in the US is 126 and above, that's diabetes. Okay. In the UK, if your fasting sugar is over 7 millimole, so these are different units, American English, and you're diabetic. So that's a answer to that question.
Right. So I see a lot of questions. We're not getting the calls, but a lot of questions are coming through via Facebook. So yeah, keep sending your questions through. We're gonna take them from here also. Hi, Doc. What causes burning sensation in the heel?
So that can be a complication of diabetes, or it can be other causes. So I wouldn't say, I mean, that by itself, I can't say, I will tell you some of the causes. But if you're diabetic and you have burning sensation, we will describe that as neuropathy. The nerve is affected and it gives problem, and usually you get it on both sides, or you can get it on one side. And classically, yes, you get burning sensation, you can get pain, you can get numbness, and that's a complication of diabetes in diabetic patient. However, you can have burning sensation for other reasons. There is something called plantar fasciitis. I don't know if you heard of that.
Yeah.
So
when it's not right, it's not flat, right?
So no, your ankle is like this. Your ankle has got an arch.
Yes.
Not your ankle, your sole.
Yeah, that's right.
The sole of your foot has got an arch, and this is your body weight is sitting on here. So you have a sheet at the bottom. It's called the plantar fascia. So it's inserted there and at the back on the heel. So think about this. The sheet is at the bottom here. You wake up in the morning, you press on it, and the arch collapses and it pulls the sheet. So it keeps pulling the back of your heel.
Right.
And that is called plantar fasciitis. And that can cause burning and pains in the heel. And classically, patients would say in the morning, when they wake up in the morning, as soon as they get out of bed, they step, they get out of bed, they feel that pain and burning in the back of the heel. That's called plantar fasciitis. And there are physiotherapy exercises and medication we can give for that. But it depends on the context. I mean, it's difficult to say burning by itself, what else can cause it. Of course, there are lots of injury, trauma, injury to the area, inflammation, infection. But when we describe burning, we talk about nerve and blood flow. So if there's a blockage of your blood vessel, you can also have burning.
Now, Doc, I like doing this running. I do a lot of running. I'm trying to do 550 miles before my 50th birthday next year. Over the year. So, for this gentleman that has this issue with the heel, wearing specific shoes, can it help with that? Because I found, because I bought some new shoes and I feel different when I'm running now.
Of course, you want shoes that supports the arch because you're doing lots of impact, and then you also want a shoe that cushion you. Remember, when you're running, your body weight is impacting on your joints. Right. So you want a shoe that can give you the cushion, and you want something to support the arches of your feet.
So somebody mentioned here bone spur, right? Because we got to go to.
We come back to that, but I was going to explain that.
Right.
One.
Yeah.
What's the difference in the U.S. and England? Isn't it the same sugar?
Right. So you spoke of the millimole. It's units of measurement, right?
It's a unit of measurement. Yeah. Like if you talk about pounds and kilogram, it's the same thing. I can have 1 pound or 1 kilogram or 2.2 pounds.
Yeah, 2.2 pounds.
So it's just a different unit of measurement, but of course the volume is the same. So it's equivalency. So bone spur.
Yeah. So it's a bone spur. So what you explained just now, bone spur is something different from that, is it?
Yeah. So, but that can cause the bone spur. So bone spur is English, is a spur of the bone. So the bone has got at the end of the bone, the ligaments and muscles are attached. The end of a muscle is attached to the bone, and you have ligaments and tendon. So end of the muscle is made up of tendon, and they are attached to the bone. So if you have something that is pulling on the bone all the time, it creates an inflammatory response, and you can have overgrowth of the bone, and that leads to a spur. So classically, you get spur in the heel. So the same condition I talked about, where the bottom of the heel is called I'm not sure. Can we do a Google while we are here and it shows up there? Is that permitted?
I'll do that. Yes, I'll do that.
So if you go Google and put plantar fasciitis, PLANTAR. So just for clarity, so I like to look. It's there, and go on to an image. Yes. Okay. If you click on that.
I'll send it to the operator. He'll put it up.
Okay. Fine. There's another. If I go.
Oh, hold on. Wait. Let me just come off screen.
Sorry.
Yeah.
It's just for clarity, because I think when you see an image, you will get to understand it better, and what can cause the bone spur and how do we manage it. If you go back onto the image, I'll show you a nicer one.
Oh.
Onto plantar images. Go onto images. Yeah, go onto this one here. Correct.
Let me see if I get some.
So this is on Google. So just for copyright stuff, I think we need to acknowledge that.
Yeah.
Just that one there. It shows
I'll
you
get
classic.
I'll get it up.
Correct. Can we get that there? Lovely. So it explains it clearly. So that is the arch I talked about. You see the ankle, the foot has got a shape. There's a space in between there. You see the fascia. It's called the plantar fascia. It is inserted in front and at the back. So you see the back is inflamed, it's red.
Yes.
So think about when you put weight down, if the arch is not supported, it pulls on the back and it leads to bone formation. And that is called your bone spur.
Okay.
And it's called, before you get that, you'll get presentation of burning in the heel. You can have pains along the sole of the foot, the heel especially, and it's all inflamed. You can't put weight down. You can't weight bear properly, and that's what you get.
Okay. Let me see we have some. As a diabetic, having cramps and stiffness, what causes that?
Well, diabetes, there are a couple of things. In terms of complication in diabetes, you can have poor blood flow. Poor blood flow can lead to cramps. Nerve being affected can lead to cramps and stiffness. So there are loads of reasons for it, but those are common things. And of course, if your sugar is not controlled, you can also have cramps and other nutrients. So anyone with cramps, especially people living in cold countries not exposed to sun, I always check their bone calcium levels, magnesium levels. I would normally do what is called a bone profile, because we find lots of people are low in vitamin D, and that also can give rise to low calcium. You can present with cramps. So I would ask patients who present with those symptoms to check with their doctor, and I would normally do other checks like their iron level and their B12 level, just to exclude other causes.
Well, I have to read this here from this message is coming from Northern Ireland. And it says, Dr. Saw, what an educator, best by profession, a renaissance in the medical field. He is a lifesaver here in the UK, was saved from blindness and other side effects from brain condition just by a casual phone call with him. Much love, Ramona from Northern Ireland.
Thank you, Ramona. No, indeed.
You remember that patient?
Indeed, yeah. Of course. Thanks, sir.
So, hi, Doc. I have a heel spur and fallen arch. I did some therapy. So, we just spoke about that, right?
Correct. So, we've covered that, I think, extensively. Treatment generally would be physiotherapy. There's something called shockwave therapy. It's a type of waves they put to break calcification. So that's probably the best treatment. And of course, you have anti-inflammatory and pain medication. But physiotherapy with shockwave therapy would be your best management of that.
Okay.
And of course, exercises and that.
Yeah. So, hi, Doc. If sweet drink can cause diabetes.
Well, sweet drink contains a lot of sugar, and it's the same principle of sugar. Yes, if you do lots of sugar, you increase your risk of diabetes, put it that way. If you're a diabetic or you're prone to diabetes, you don't want to use rapidly acting sugary stuff. So cakes and sweet drink and anything sweet that causes sugar to go straight into the bloodstream, you want to avoid that. You want to use what we call complex carbohydrates, or sugar that release slowly in the body.
Somebody says, what causes stiffness in the muscles?
Again, muscle stiffness can be one, lack of use or overuse. So if I don't use my muscle for a little while, it will get stiff. If you just see patients who come out of plaster Paris, the muscles are stiff. So lack of use. And if you overuse the muscle, they can go into cramps and they can get fatigue and they can get stiff. But otherwise, we would want to look on muscle function is a function of blood flow, nerve, and electrolytes. So when the muscle contract, there are movements of chemical electrolytes, salt and water movement that causes the muscle to contract, movement of the muscle itself. So if you have deficiency in those electrolytes, so we talked about calcium, magnesium, we talked about iron, ferritin, B12. So I would normally check for those things, and of course, look for nerves and blood vessel issues. There was one question on thyroid. Somebody asked me to talk about last week.
Yes, yes.
Was there anything there you want to bring up, or shall we go to thyroid?
No, go to thyroid, yeah.
So, okay, just briefly on the... You want to take that on the...
Let me take this call, please. Yeah. Good evening, caller. You're live on air.
Good evening, Akash. While I'm trying to... how accurate is the sugar machine where people just buying and testing? I'm a diabetic. That's why you're asking.
Okay. Yeah, I mean, I would say it's pretty accurate. Lots of the machine now, they have to go through stringent testing and calibration. They are accurate. They're very accurate, provided, of course, it's a brand that is well established and, that it is really well established. Now, there are a couple of things, however, to note. One is that they're accurate enough to give you an idea what your sugar is like. But the gold standard, of course, would be taking blood directly from the veins, which is a bigger vessel, because sometimes you can have other things that can interfere with the values. The blood delay of the blood flow to this finger prick. For instance, we do the finger prick testing. The blood can be delayed. You can have constriction of the blood vessel. But if you're gonna, I would say from my experience, if they're gonna be out of line, it's gonna be marginal, but it doesn't make any it doesn't make any difference really. So let's say you're 5.1 and your blood one is actually 5.2 or 5.3. So by and large, they are accurate enough for you to manage and to understand your blood sugar levels. And then, of course, when we look at how well you're controlled, we normally judge it by your average sugar over 3 months. And we take serial readings. That's why I wouldn't tell a patient, right, your sugar is high now, you're badly controlled, let me change your tablet. I will have to have a couple of readings to be convinced. And of course, yes, if it is exceedingly high at one go, I will definitely repeat it and then treat it acutely.
All right, thanks a million.
No problem.
Thanks for coming through, man. Yeah. So, you want to you were telling the thyroid.
We were talking about the thyroid. So the thyroid gland is a gland in the neck, and the thyroid, it produces a hormone called thyroxine, and thyroxine is needed by the cells to burn energy and produce energy. So the thyroid gland can either overproduce or underproduce. So if it produces too much thyroxine, it's called hyperthyroidism. And if it underproduces, it's called hypo, that is HYPO, thyroidism. And there are various causes why it will overproduce or underproduce. So commonly, let's say it is underproducing, we call it hypothyroidism, and common cause would be the body can attack the gland. So you get autoimmune thyroid disease, we call that. You can have a viral infection and the gland get, inflamed. Usually it can cause high or low when the gland is inflamed. It can be destroyed by things like radiation, certain drugs, amiodarone, lithium. There are some drugs that can affect the thyroid gland, and it causes the gland to underproduce. And it's easy, by and large, the majority would be autoimmune, where the body attacks the gland. And we run some tests to see what it is, the cause for it. And then, of course, it is adequately managed by giving thyroxine tablet. That is for low thyroid. If we take that,
Yeah,
and then we come back to
and I have two questions
hyperthyroidism.
coming that came in on Facebook also.
Mm.
Good evening, caller. You're live on air.
Hi, good night, Mr. Carson. Dr. Shaw, I'm just looking at the program.
Thank you.
Thanks.
And another gentleman had a question just now, which I asked similarly like a month ago, in terms of those machines for accuracy. Within a plus or minus 5 or something. My advice was, and that was my doctor told me, he probably could take it to his clinic, and at the clinic they can do a blood test that day, and at the same time he can do his finger stick with the machine, and then compare those two results and see the differences, because the one from the clinic should be accurate, and at the same time he does one with his machine, and then you can look at the result and would give you an idea if the machine is functioning or how much difference it is.
Of course.
It would help him and he can think of that.
Yeah, I mean...
Very much, and I'm enjoying this program here.
Oh, thank you. I mean, thanks for your comments.
I mean, the first time I'm saying this, how often do you folks have this program? I actually call it from the state. And I hope you're working.
How often you have the program?
Once a week.
Yeah.
Every Tuesday night at 8 o'clock.
Everything. Thanks very much. I'll probably keep tuning in as long as I'm home.
All right, thanks. And do share it and tell everybody else about it too.
It's a good comment. Yeah, thank you.
I will go and, as I said, it's very informative, people, to learn about this stuff. And being preventive medicine, I think, is very important. And it's a way to go to reduce a lot of effects. For instance, diabetes has many secondary effects, and it's good if people can take care of it very early. So it's a good thing you folks are doing. Continue the good work.
Thank you.
All right, good. Thanks for coming through.
So indeed, one of the way, indeed, you want to do that. You can do that. The lab tests your blood, that is more accurate. But more often, you would have a marginal difference that, as I said, is insignificant. But that can tell you if your machine is functioning or not. But a machine nowadays, it's pretty cheap, and most places in the Western world they give it to you free. The strips is costly.
Okay.
So the company give out the machine for free, and then they make money by you buying the strips.
Yeah.
Now, I just want to say that there's some new testing. So people heard of the continuous monitoring, glucose monitoring, where you put a patch in the arm, and it tests the sugar continuously, and it is read on the phone.
Yeah.
You get a signal sent directly to your phone and it tells you your sugar reading.
Wow.
Now, that's your standard. We tend to, I wouldn't say it's an expensive thing to do. I wouldn't say that patients who are not, it's a good treatment. I would say that should be the gold standard for everyone on insulin. Because insulin can be so erratic in its action and your lifestyle that it changes your sugar, rapidly. So everyone on insulin, that would be our gold standard, but it's a costly thing. So I don't think we have got that. Even in the best of countries, in the UK, in America, they don't even prescribe it routinely. We reserve it in the UK for children with diabetes and very uncontrolled insulin patient insulin whose sugars are not controlled, or high-risk patient. But I think over time it will be more cost-effective, and anything that is new over time it gets cheaper. So I think that will be something we have to look out for, and it's available here, so patients could afford it.
Two questions here. This one here. This person is asking, "Good night, doc. Is it healthy to go on a natural herb? Example, going to and mention a specific place on the East Coast that does this herbal treatment, so to get your system flush out before getting pregnant."
I mean, on a medical point of view, if you're going on a retreat for relaxation therapy, excellent. Because if you're in a good frame of mind and less stress and you're in a nice environment, yes, it increases your chance of getting pregnant. But I will warn that going on a horrible flushing is absolutely, in my medical advice to patients, I would say no. That's a no.
Yeah.
I tell you why. Two things. One, we don't know what herb you're going to take. And I don't know the effects of those herb on, let's say you take the herb. Now, any medicine you take, it stays in the body for a period of time. Tablets, anything. So it is metabolized by the liver, excreted by the kidney, and you can excrete from other parts of the body. Yeah. But by and large, kidney, metabolized by liver, excreted by the kidney. Now, if I take a herb that stays in the body for a month, and then that herb has got an effect on the fetus, or on baby in the early stages of the formation of the baby. I wouldn't know that.
Right.
So I would advise, on a medical standpoint, I would advise against taking herbal treatment prior to getting pregnant. Pregnancy should be a natural thing. You want to eat healthy. You don't need to go on anything specific. What I would say to patients, have a healthy diet. You can have a general check to check that you're not anemic, that you're not deficient of any vitamins. Optimize your health, be in a good mental state, and then, of course, you go try for pregnancy. But I would just add something to this. Lots of patients would come to me and they said, Doc, I want to run a couple of tests because I'm planning to get pregnant. And I would advise them similarly to say, fine, you could do a few tests to check those general things. But let us not, for instance, guys would come to me, Doc, should I have a semen analysis before I start me and my wife trying to get pregnant? Yeah. I would say, no. You guys start for a pregnancy, try for a pregnancy, and if it doesn't happen, then we'll start testing you.
I agree with
because we don't want pregnancy to become something that is a chore. Yeah. We don't want you to start worrying. Imagine I do a pregnancy, a semen analysis, and it comes back, you've got 5,000 sperm.
Yeah.
And you need one. However, of course, that's a low count.
That's right, yeah.
But my point is, I've seen patients with under the level that is recommended, they still impregnate their wife or their girlfriend or whatever. But the point is, it should not be to say, fine, now I'm worried, my sperm count is low, and it then become psychologically, it's a barrier.
Yes, I think I say certain things you should make it a walk. It shouldn't be like a walk, right? So this person, I noticed that I sit and read, my arm starts to pain and get stiff and swollen. What's causing that?
It's difficult one in terms of to know what exactly is happening. So if you sit and you're immobile, it depends. If your arm is hanging down, you can have blood flow issue, which is it gives you swelling. If there's problem with blood flow in terms of water retention, you can get pain. So if you hold up a book like this and the blood is not flowing properly, you get numbness and you get pain, you get spasm of the muscle. There are lots of reasons. I need to get some more information on that as to what exactly is happening there.
So the person sent a message. I hope that answers in some way. I think we dealt with this one before, but if you could do this very quickly, Doc, what's the range for normal blood sugar testing?
We discussed 126 and above.
That's right. Yeah, we did that.
Thing, and in America and in England, value would be 7.
Yeah. Sorry, so we're gonna stay on for a few minutes more to catch up for the time that we missed with you guys. Maybe another 5 minutes or so. Ooh. So send in your questions. Call. Let us know. Were you finished with talking about thyroid?
Oh, thyroid, sorry. Yeah. So, okay, we talk about low thyroid. So that low thyroid usually is autoimmune. That is, if there is no identifiable cause, the body attacks the thyroid gland itself and it's underactive. Iodine, in some countries where you don't have iodine-rich food, because to produce thyroxine, you need iodine. So if your iodine is low, you can have low thyroid as well. Now, of course, it is managed by giving thyroid tablets. So the thyroid tablet is called levothyroxine. So we give that, and usually it's well managed. Of course, there are things we will do. We'll do a scan of the neck, see the thyroid gland to ensure there is no other cause for it. Now, what are the symptoms? Just quickly for low thyroid. Yeah. As I say, thyroxine is needed for your body to metabolize to produce energy. So if your thyroid is low, you're lethargic, you're tired, you can gain weight, you can lose your hair, you lose your eyebrow, you lose your eyelashes, your skin get thickened, your voice can change. So these are your classic, and more importantly, you feel cold because you're not producing energy. Your energy level is low.
Right.
So, and you gain weight. So those are the features for hypo or low thyroid, hypothyroidism. If you have high thyroid, on the other hand, you're producing too much of the thyroxine, and that again can cause by something called Graves' disease, where your body is producing too much by an autoimmune process, or you have an extra lump in the gland that is producing it. Again, you will lose weight. You get tremors because you are always hyper. You're sweating a lot. The place is always hot, so you get heat intolerance. You can have diarrhea, palpitations. That's an important cause for hyperthyroidism. Patients can go into irregular heart rhythm. So if I have a patient, especially in the older patients who have got something called atrial fibrillation, we always check their thyroid to ensure that they're not hyperthyroid. So yeah, and of course, again, it's managed by giving you medication to block the thyroxine.
Yeah. Well, so if you have any more questions, we're just going to take about one more question here, and then we're going to... so remember, you can WhatsApp your question into us via the WhatsApp numbers on the screen, or you can call. So I think we are probably up to time tonight. So I want to thank everybody for joining us. I hope you've enjoyed the show. Share it with your family and friends, and let them share it with, especially in the community, so that they will know about the show. That is a forum for them to ask questions to Dr. SAW. And we hope that we bring you the information that you rightly seek. And Dr. SAW, he's an amazing person, and somebody from Northern Ireland just sent a message about an intervention that he did that saved that person's life. So, you know, and Doctor always says that he will answer these questions to the best of his ability. And if he's not certain about something, he will say that he's not certain about it. And, absolutely, you know, information can be sought elsewhere. So thank you again for joining us, Doc. It was a pleasure again tonight. We didn't get much calls, but thank you for sending your messages through WhatsApp and Facebook. And we will continue in this trend. We'll see you next week. And remember to take care on the roads if you're here in Guyana, wherever you are. Stay healthy and have a wonderful week until we see you next week.
Thank you.